Call this meeting to order, Benton-Franklin Health District meeting, Wednesday, the 24th. We are going to jump into executive session for 5 hours. Just kidding, 20 minutes. Do we do it right now then? Exec session?
Yeah, to include the board.
Yeah.
Brandy and Amanda.
Okay.
Martin is also on.
Oh, Chris is on now too. Perfect. I will set a timer for 1 minute.
Do you want Chris in for the application or just general?
Chris, do you want to be in for the application discussion or just general?
I do not need to be present for the application.
So Chris will be joining executive session?
No.
No.
No, I'm staying in general.
Yeah.
Unless you want me there.
No, Chris, go ahead and take a nap and we'll call you when we're needing you.
I'll stay wide awake.
All right.
Maybe he's not feeling it.
All right, you're out of executive session, times 1:52. Notices were made, direction was given. Let's move on to approval of March 20th, regular board health meeting minutes. Create a motion.
I'll move approval of the minutes as presented.
A motion is second, in discussion. Hearing none, all in favor, say aye. Aye. Any nays? All right, guys have it. Moving on to public comments. Is there anybody here that would like to make public comment? No one? Oh, go ahead.
It's mainly just an introduction. My name is Leland Kerr. I'm the superintendent of the Kennewick Public Hospital District. We have changed our mission, as you're obviously aware. We no longer have a hospital, but we are looking to be able to provide services in the healthcare industry in need. We are looking at the assessments, and frankly, at this stage, we are our primary objective is adult daycare, as you're maybe aware of ADS, and we're looking for other particular missions, and we're looking to hopefully partner with the health district on some as you see issues that we might be able to participate in. We'd like you to keep us in mind, and like I said, we'll open our invitation and see if we can get a little closer relationship. So please, if you have any questions in regards to the hospital district or what it does or what it can do for you, please let me know. Thanks.
I don't have questions. Do you have a card?
I don't,
Okay.
but I'll give you the information, okay?
Okay.
Nicely.
Do you have an iPhone?
Yes.
All right. Is there anybody online?
If there are any members of the public that would like to comment, please raise your hand in the Zoom app or press *9 if you're on a phone.
Is anybody on there?
I'm not seeing anybody.
All right, we'll close public comment. Senior staff comments.
You guys look way too serious. Now you're smiling. I want to see all back. Okay, good. Now I'm good. I'm good. It's a good day.
No senior staff comments. All right. Unfinished business. Health officer recruitment update.
Hello, thank you for allowing me to speak. We have been posting the health officer position, and I have posted externally with many different external avenues, employee diversity, healthcare news, which is nationally based, so across the whole nation, LinkedIn, as well as in several other governmental agencies. At this time, I've gotten 55 applicants, which is a great response. However, there's only about 17 of them that are qualified just on the surface. And so my intent is to continue to review those applicants at this time. Then we can review them for next steps in the next 30 days. And hopefully we'll have a pool of candidates that are viable to be able to review and move forward at that time. Out of those candidates that are qualified, several of them, about 5 or 6 of them, are out of the country. So it will take some coordination efforts to be able to review speaking with them. That is my update for the health officer. Next, I'm going to move into the district administrator recruiting committee.
I just have a quick question on that. So as far as that, is it anything to do? I just want to make sure that, we're getting a good wide range and pool for us here. Do you feel that the salary caps or anything like that that we put around that, those parameters, has that affected it, you think, at all? Or we maybe get other people involved because it is a physician, it is a doctor. I was just
It may
curious.
very well be. I think I see it on both ends. That's why I see a lot of people who are applying that aren't qualified is because the salary is good. But then we may not be seeing as many qualified candidates because it may be on the lower end.
And so that brings up another question, and I see the money guy over there, because we're both money, we were talking about the other day. Is maybe HR, management, and finance can get together and see if that's an issue, and if it is there potential for the funding to increase that salary cap so that we can have a maybe a bigger pool of qualified candidates? That was just something maybe to think of, because we definitely want someone here that's going to be successful and be here long term. Versus maybe a jumping or board to do something else.
We need candidates within the state.
Two, I've got two local, there was two others that weren't qualified, but there are two that are not, one in Washington, but one in the Pacific Northwest. So one seemed very, very possible, so.
Would that be okay with you guys, maybe if they do that? Just to see, I'd be curious. Yeah.
Did we close the loop on the previous health officer then? Is that? Okay.
Yeah.
So we have our interim health officer, Dr. Krieger, which is what we went through at the
Right,
last meeting.
right.
And so he's on board with
Great.
us as our interim situation. Is that what you're asking? So,
No,
no. Maybe I'm missing something.
you're just asking if we're done with the other.
Yes.
Yeah.
Oh, yes, we're good.
Okay.
Thank you.
We have an intern. Okay, any other questions, comments? Okay, for the district administrator recruiting committee, the committee has been reviewing the employee survey that was submitted in January and February, and we have developed interview questions based on that. We've got a very, very good, strong amount of first round interview questions that we have drafted and a scoring sheet. We are moving forward with some of the selected candidates that we will move forward with interview process, and more information to come and follow on that. So that is it. Any questions?
Thank you.
Thank you.
Thank you.
All right, new business. Dr. Krieger.
So I would like to jump in on this one and just introduce you guys formally to Dr. Stephen Krieger, who is our official interim health officer. You may recall at our March meeting, we approved 4 resolutions. The first 2 were for instating Dr. Lindquist as our interim health officer to replace Dr. Lutz, while we continued conversations with Dr. Krieger. But preemptively, since we suspected that we might be moving forward with Dr. Krieger as our interim, we approved an additional 2 resolutions at that time, instating Dr. Krieger as of April as our interim health officer, with Dr. Lindquist now working as our backup health officer in times of need. And Dr. Lindquist has agreed to that. So it is my pleasure to introduce you to Dr. Stephen Krieger, who is the current health officer also for Cowlitz County and Mason County. He comes highly recommended, not just by Dr. Scott Lindquist, but Wasalfo, who's part of WASAC, as well as many other peers across the state. And I have to tell you, his first week here has been absolutely phenomenal. Even though many of us were out, he jumped right in terms of some GI and measles situations that we were working through, and it was like he's been doing it all of his life. So we're very appreciative of him jumping in with us. And so with that, Dr. Krieger, I'll turn it over to you to introduce yourself to the board.
Thank you, Janae. Wow, I know I'm like really big. Thanks for that introduction. It's great to be here. I'm looking forward to meeting you all in person. I hope we can do that maybe sometime in the next couple months. Janae asked me just to kind of briefly introduce myself, and then I have a couple real short kind of topics just to touch on, and I want to continue that pattern of kind of giving you some updates about, at least from my perspective, kind of what's important and what's interesting going on from the health officer world and public health in general. So I grew up in the Pacific Northwest. I attended medical school at Creighton University in Omaha, Nebraska. I did a year of pediatrics in California, and then finished a preventive medicine residency at the University of Colorado, where I also got my master's in public health. Got some really interesting experience there, working for partly working for the CDC during the Zika virus outbreak, which was fascinating. And then, you know, all my family's in the Northwest and the Oregon area, so I wanted to move back. Found a job part-time as the health officer in Columbia County, Oregon. And I also worked kind of as a medical director for some primary care clinics, nonprofits in the area, and did some primary care work. But I still had, you know, a passion for more full-time public health work. So there was an opportunity in Southwest Washington with Clark, Cowlitz, Skamania, Wahkiakum, and Pacific counties to be their deputy health officer in September of 2019. I remember I had like barely started, and I was sitting in the office in Clark County in Vancouver, reading about some, you know, mystery illness in China, like late December 2019, being like, huh, that's interesting. I have to keep an eye on that, which was, you know, that was an interesting way to kind of start my full-time public health work. I still feel like I'm trying to figure out exactly, you know, the fullest picture of what public health looks like outside of, you know, the pandemic. And there's lots of amazing work that's being done. So I recently left that role. I continued, I was appointed as the health officer in Cowlitz County, and then just recently Mason County. And now, you know, I'm very excited to be working for Benton-Franklin and you all. I just want to mostly highlight, like, I hope we can have, you know, healthy dialogue. I also just, you know, I appreciate board members' perspectives on, you know, you are really representing the community. And I do want to emphasize that I really think that that's important. I want to hear from you, like, what is going on, what needs there are in the community, and if we can kind of work together to address some of those. So I'm looking forward to doing that. And again, if there's, you know, Janae has my contact information, you can reach out to me at any time. That's a little bit about me. I could talk forever about me, but that's boring. I'm gonna just do a couple public health topics real quick. And then obviously, you know, if we have any questions or anything like that, we can handle that. I did want to touch on respiratory illnesses. Thankfully, we've kind of winded down. You know, we've kind of focused on, especially the last couple of years, COVID-19, influenza, and RSV. Those are the three kind of viral illnesses that cause the most sort of hospitalizations for our most vulnerable people. Thankfully, in Benton-Franklin, and this is true kind of across the state, we're at very low levels of all three of those in terms of hospitalizations. We did see some kind of winter spikes, especially with influenza and RSV, but those have diminished. I will say, especially influenza and COVID-19, it's still spreading, it's still present. We're still seeing hospitalizations, but it's quite a low level. I'm sorry I don't have any slides today. I'll have some more slides. I'll have slides next time, and we can, you know, kind of talk over things visually as well. Influenza is kind of an interesting season this year. We had a less intense kind of spike in terms of influenza activity and hospitalizations, but we're seeing just a slower tail off, I would say. So influenza activity is still around, but it's pretty low. The other kind of topic that I think is kind of fascinating and has been in the news a little bit, and which is why I wanted to talk about it, is called, you may have heard of, kind of colloquially called bird flu. We call it HPAI, or highly pathogenic avian influenza. The other term is, and now I'm like double checking to make sure I get the numbers right, H5N1. What should I call it? I'll probably just call it bird flu because that's just the easiest thing to kind of think about. Unfortunately, it's kind of a misnomer now because it's infecting many other animals. I wanted to touch on it because it's kind of this fascinating interplay between, you know, animal health and human health. You know, a couple of years ago, we started seeing a large amount of bird flu in the United States. You know, we had significant impacts to our poultry industry in terms of like eggs and chicken. That virus is still spreading. It's not at the level that it was, What's causing more concern recently is that we've seen it in cattle. So most 33, as of today, we've had 33 dairy herds kind of across the United States, I think in 8 different states, Idaho being the closest, that they've detected this virus in cattle. And then a couple weeks ago, we had one confirmed transmission from cattle to human. It's an interesting virus. I will say the name highly pathogenic avian influenza is a little bit scary, but it's highly pathogenic for animals and especially birds. It doesn't actually seem to be affecting cattle that much in terms of like severity of disease, which is nice. Chickens, unfortunately, when it enters a flock, it basically kills the entire flock very quickly. That isn't happening with cattle. But it's still concerning, right, that we're seeing it in different types of animals. And so we're watching it really closely to make sure, I mean, we're doing a lot of things with it, right? So we're watching, monitoring the kind of transmission that's happening, seeing if it's affecting other animals, doing genomic analysis, so looking at the genes of the virus and making sure that it's not changing rapidly, right? So right now, it is not changing rapidly. It's not, it doesn't have changes that would make it like more likely to pass to humans. And it also doesn't have any sort of, ability to pass from human to human right now. So just kind of a really interesting thing. And then the last thing that I noticed, I was just researching this today, the USDA just put out an order requiring testing before any interstate movement of cattle, of dairy cattle, which is, going to be a burden, I know, for dairy farmers. But I do think it's kind of an important step to try to slow kind of the spread of this. I don't want to, I'm not super concerned about this at this time. I think it's something like, again, from a human perspective, we're keeping a close eye on. Right now, there's only been 2 infections in humans. One was, from a chicken to a human, one was from a cattle to a human. That was in the last 2 years. And both those people had very mild illness. So that's the other piece of this, is even if it transmits from, an animal to a human, the severity of disease also seems to be pretty mild. Unfortunately, influenza can mutate, become more severe, more infectious. So that's kind of the concern and why we're keeping an eye on things. Those are the 2 things I wanted to touch on. Again, I'm happy to be here. I really appreciate the opportunity to serve your counties, and I want to be a resource for you all.
I did have a quick question for you. So I know you're talking about chickens and you're talking about dairy cattle, as well. Has that crossed over to like waterfowl, deer, or wildlife? Waterfowl, deer, elk, those type of things? Have you seen that at all?
Yes. Let's see. I was just looking at this. There's definitely been quite a bit in other migratory birds.
Okay.
I don't know them names off the top of my head, but they actually think that it was probably wild birds is how cattle eventually, got infected. Barn cats and some other wild animals, which I'd have to, goats I had seen. So yes, the biggest populations have been in, poultry, but definitely a lot of wild birds that we've seen as well. And then more so in cattle right now.
So not your big game, your deer, elk, those type of things.
I'll have to double check that. That's a good question. Yeah.
Thank you. Thank you.
I guess I have a question. When you talk about cattle, it's my understanding is so far it's only been in dairy cattle.
Correct.
And dairy cattle, that's not just because of the breed, it's because they're close proximity to each other.
Yes, that is correct. I don't think there's been any other types of cattle affected besides dairy cattle at this time.
Thank you.
Thank you, Dr. Kerr.
Thank you.
Nice to meet you.
Right.
Listen.
You'll kind of, Commissioner Albert, as your question about the birds. After one of the Ducks Unlimited meetings I was at, I overheard, this was 2 years ago, I overheard a conversation about they'd gone down to those islands by the dam.
Yeah.
And went to get, there was a bunch of snow geese and they were collecting the bands. And there were thousands of dead snow geese. My public health hat goes on and goes, oh my gosh, they are boots through a whole lot of dead goose poop.
Yeah.
And so I called DOH and Fish and Wildlife went and tested, and yeah, it was highly pathogenic avian influenza. And that's why, like, when you harvest your ducks out, say at McNary or someplace, now and again they're out there, they'll swab and they'll test. And so that's actually, what they're looking for.
Okay.
So,
Wow.
yeah,
Well,
we
thanks
will
for
be
that.
having a booth at the next Ducks Unlimited thing with this good information.
It's good educational information for me.
It is, and kind of on the deer, what we're really looking at in the deer right now is the chronic wasting.
Yeah, and even potentially elk. I don't know. If it's
Yeah,
elk.
yeah.
Okay.
And if you're harvesting deer, out at Hood Park, my husband hauled one of his deer in there and they pulled some neural tissue and a molar to age your animal and then look at the neurological tissue. The problem is you don't get actively what the result was. I guess you have to go into a portal and put numbers in to find out what happened with the animal you harvested, which of course my husband didn't go.
I know they were doing that in the Silton too.
Yeah.
The wildlife biologists were checking that stuff
Yeah,
as well.
yeah.
It's
So
that's
it's
why yeah.
both of those are being watched pretty closely out there.
Thank you for that.
And as a backyard bird flock owner, of course I worry about the wild birds because it decimates the chickens, like happened out at the egg farm.
The good news is apparently it's been mild cases when it's been transferred to humans. So
Yeah,
cross our
very
fingers.
rare, very rare. All right, my part of our little conversation here, do you have my slides up, Lauren?
Working on it.
I know a few months past, Dr. Giske mentioned that I was appointed to the governor's Public Health Advisory Board. And so I've been attending those meetings regularly, and I wanted to give a really quick update as what we're doing and where we're going with that. So next slide. Again, Public Health Advisory Board, FAB. You also hear about FAB in relation to Public Health Accreditation Board. Two very different entities, very different purposes. So the Public Health Advisory Board was actually established by the legislature in 2021, and it is a governor's appointment for your term on the board. And our charge is to give feedback from the local level back to the governor's office and make recommendations on how we think things should be. Our first charge was to look at COVID-19 after action reports. And thank goodness I came in just after all the reading happened. So I got the brief synopsis, but read a lot of after action reports from a variety of entities around Washington State, community members, groups, all the way to facilities, to public health, to EMS, you name it, they wrote an after action report. And then we compiled all that information and came up with some recommendations that we saw as general themes throughout all these after action reports. There's nothing more frustrating than to get through something like COVID, write our after action report, and then it goes into a dark hole somewhere, never to be seen, touched, acted on again. And the lessons learned are lost very quickly. And that's what our attempt with this board is on a certain level, not to lose sight of what we learned and what we need to have in place moving forward. I sit in the seat that represents communities on the east side of the state, population of 200,000 to 600,000. And I have a counterpart who is also on this side of the state who represents the smaller counties. We do talk to each other. I've reached out to staff in-house who had knowledge and expertise of our COVID response and got their thoughts and opinions. And as we move forward into other topics, I will certainly be reaching out to other community members because it's not just my voice I bring to the FAB, it's the community's voice to the FAB. Next slide. So this is kind of the timeline of the response recommendations. We've been through all the reading and the discussions, and now we are ready to publish our response plan and our recommendations to the governor. So next slide. And recommendation 1 was essentially identify and sustainably fund streamlined data and communication systems. Something we found throughout COVID is communication systems don't talk to each other. They're clunky. Our data systems don't talk to each other. They're very difficult. Washington State is undertaking a data modernization plan at the level, at DOH level. And at a meeting I was at yesterday, it was really exciting to hear some of the plans they have in place to actually not do it in a vacuum at the Department of Health level, but actually come out to the local health jurisdictions and meet with our data people out here to find out what we need, how can we work better together so that we honestly do have a product that serves our public in the long run. Next slide. And prioritize community integrated health and emergency response planning that supports improved system capacity, funding flow, and decision-making. We really saw concern with how dollars arrived in our community. There was a lot of confusion. What can you use them for? What can't you use them for? How quickly they came, how slowly they came. But we also identified the fact that there were a lot of players in our community who were expected to participate in the response, and they did not get funded. And we really need to look at making sure that our partners that are involved in a big response like this actually have a financial incentive to come to the table and have that conversation. And that quick access to the funding was imperative. Next slide. Adequately fund capacity to build and sustain relationships and partnerships. This does kind of fit in with the funding aspect. During COVID, we worked with a lot of partners. Some we were very used to working with, a lot of them were new to work with, and we need to not lose sight of all those relationships we built. But we also need to make sure that we are creating sustainable ways of having these conduits open. Plus, there's that financial aspect of how do you encourage other entities to communicate with you if there's nothing to cover the cost of that staff person's time to be involved in these efforts. We also really looked heavily at who all is involved and who runs the show. And yeah, public health is a heavy hitter in this, but we also really need to keep sight that we are co-decision makers with our community, and we need to keep our co-decision makers close at hand if something, when something like this does happen again, we'll have those relationships built, they'll be ongoing. And so a lot of focus on maintaining all those relationships that we built. Next slide. So the next steps, like I said, the recommendations will be going to the governor's office. We'll see what the response is there. And then FAB will be choosing our next topic. They will likely have something to do with foundational public health dollars, because we are also charged with how are those dollars being spent, how is it working in our communities, and topics more around that. I think that was my last slide. If you're more interested in what we're doing on the board, there is on the website, there's a link to the portal to learn about what we're doing. Questions?
Oh, thank you.
Yeah. And Amanda and I apologize for walking out on today at your talk over.
Oh, I wasn't even paying attention.
Well.
I don't mean it that way.
Now you had your reading glasses on, so I assured Amanda.
You know,
he didn't see us at the back of the room anyway.
I was focused on 7 pages of 11 font.
Yeah.
You were just testing your speech.
That hurt.
Mr. Janae.
Yes, okay. So, beginning of March, we received notice from Franklin County that they are intending to surplus and or sell the Clark Street building that they have, where we are co-located with the Franklin County WSU Extension as well as the elections office. And so we have been on an adventure. This wasn't necessarily foreseeable for us. However, we are welcome the conversation. I think it's mutually beneficial for both parties to, I think what we discovered last year in the Spalding situation in terms of data is, you know, where we're located in the Bi-County area is important. And so to realign more central, at least in the Pasco area, is beneficial for us. When we look at the movement of where our clients are, at, where they might be and where they would benefit from our services, moving more central West Pasco was in our favor. And so we wanted to continue those discussions. So we did. I also put Chris Mertens on notice, our attorney, because we do have an active lease with Franklin County. to make sure that we navigate those legalities correctly, make sure we maintain our best interest through this. And I will say Chris has been absolutely phenomenal through this. He has been my rock in terms of navigating, working through these lease situations and how we move about in terms of the new property. That being said, my next rock in this has been Rob Ellsworth. He's been absolutely phenomenal to work with. He is representing us in trying to look at additional properties. We've looked at 7. I will tell you, our leadership has been very engaged in that. It's nice to have a fleet of stakeholders in this internally that are out there helping us to find the next right fit for us. Some downsides for us in what's out there is there's not a lot of clinic space that's even a mixed use of clinic and business, which is really how we're set up. And so for us, we know we're gonna have to do some modifications. So finding the right space to invest in those modifications is gonna be critical. Franklin County has extended the support to be able to help us with those unexpected costs that come with having to move something like this unexpectedly. So we're continuing those conversations with Mike almost like every week or every other week. We have narrowed it down from 7 properties to 3 properties. I suspect we're gonna be narrowing that down here in the next week from 3 to possibly 1 or 2. We're also since we know we're gonna have to do space modification and we are not experts in space planning, we're gonna be working with Bruce Baker, who's a local architect, to help us do some space planning and figure out how to best modify the space, whatever space we choose. So that you're aware, we're looking at 3 locations. Our current lean, but not official, is the location off of Westport. It's across from the post office and the Autoplex. It's right next to Goodwill. It's a former plasma center with about 11,000 square feet, and it's got a mix of clinic and business. But since it's set up as a large plasma donation center, there's a large open area that we'd love to turn into some office space and some meeting space that we could make use of, especially since we've got some constraints here at our Kennewick office. The other 2 locations that we're looking at, one is off of Wrigley, off 68. There's the Wrigley Medical Building there. It's on the 2nd floor. It was a former pediatric dental clinic. So again, modifications would have to be made. And then the other one is off of Road 100. It's I don't know if you know where the Lord's Clinic is at there, and it's just down the road from that, down on a cul-de-sac on Bedford. It's an former OB clinic. It's a pretty tight, cozy fit. So if we had to move, that could be an option for us. But if we have some time, we want to see what we can do with some potentially other favorable locations. So that's where we're at right now. We'll be meeting with architects, continuing our conversations with Rob, and then at some point I can bring back to you guys some proposals for where we move forward. Yeah.
If I could ask Commissioner Mullen, what precipitated the decision on Franklin County to close?
Someone came forward and made an offer on the building that, yeah, if I could be honest, in my own opinion, we should sell it. But we are getting a lot of back pedal from other departments in the county as far as surplusing it, so. Whether or not it will go through, I can't tell you. I can almost surely tell you that Franklin County does not have any money to help anybody move. I mean, I can't speak for all 3 commissioners, but knowing the state of the county and what we have in funds, there's simply not there. It's not a matter of not wanting to help, but we just do not have the funds.
What's the time frame on the sale versus moving and stuff?
First, the building would have to be surplus.
Yeah. Okay.
And that's a long process. So we've actually been working on a different resolution that would allow us to sell it in a much faster motion. Typically would be following the same resolution that the city of Pasco has as far as surplusing government property. Because to surplus government property, you have to prove that there is no longer a need. And we definitely need an elections department, but they're saying that they will lease us back that portion for a very small amount. It's not a very good location. People don't feel safe going down there. The people working there don't feel safe. And in my opinion, we should sell it and move on, but
so real quick too, I just had a thought on my head. What about is the buyer thinking of like keeping you guys as a tenant, or are they like a completely different operation?
they would only allow the elections department.
Oh,
They
gotcha.
know
Okay.
That the other two entities would have to relocate.
And so for us, on a financial perspective, we do have some reservations, which is part of why we're having ongoing conversations about how to make this happen.
Yeah.
Right now, we pay about $30,000 annually for the Pasco office, which is a steal.
Yep.
So when you have to wade back into the market and the current rates, it's a bit scary. And so we've shot an arrow down the middle to say, okay, what if we're looking at something around $100,000? How would that impact our budget? Again, unplanned. So we're looking at having to pull out 70,000. We know that that's gonna come through indirect and right back out of our programs. And so we've already prepared them for that potential budget adjustment. When you look at the costs on top of that for relocation is where we're trying to work through that with Franklin County to figure out what we can do without dipping further into our programs and services, because it is a balanced budget. You know, that money's gotta come from somewhere.
I can tell you, I think our emergency fund, which should be 5 to 7 million, is at 200,000. So that would be asking for a third of our emergency fund.
Yeah, I think from what we've talked about with Mike thus far is I think what he was kind of indicating is from proceeds, if there was any way to recoup some of the costs that we might incur. But this is all discussions.
Yeah, he hasn't conferred with the other commissioners.
We still got a ways to go, but we're doing our part in this to support Franklin County as well as figure out how we can benefit in terms of a better location for our clients and the services that we provide.
Well, one way or the other, you have the experience here. I don't know how you got that good team you built. But anyway, I think that's a good thing. You guys will be able to go ahead and make good educated financial decisions. You have a good team to support you to move forward, whether you do it or not. I think they're going to give you the straight up information.
Absolutely. Yeah.
Sorry about that. I got it a little.
I'm just saying, I think any of the funds that come from the sale of that are going to go directly into an account.
Yeah.
That is going to start building so we can build in a different elections department because we can only stay there so long. It's just the reality, in my view.
I understand. And Rob's got some creative things for us too, in terms of how we can work with the new building and the owners to make those modifications. It's gonna cost money too, on top of the increased lease payment. And work that into the lease. So we're working through several different options.
Do you think
improvements?
seems like that plays into some of that earlier conversations though about our rate for the new hiree to taking some of that into, because we want to support our current staff and programs.
Yeah, and with the recent nursing adjustments as well.
Yep.
Yeah, there's a lot coming at us, but
Yeah.
we're stable. We're stable.
We just talked about that an hour ago.
Any other questions? All right, we'll move on to nitrate project.
You guys are good there.
All right, got it. All right, thank you. Erin Hockaday, Senior Manager for Surveillance Investigation. I know you probably see too much of me up here presenting on environmental health and S&I work. But today bringing a little bit of a presentation on some of that additional work that may be coming at us soon as we're talking about. I'm really glad that Dr. Prager focused on the HPAI earlier. It really just is in the same vein of this presentation in talking about that concept of what we call One Health, where we explore that intersection between animals, humans, and the environment. So this, nitrates really speaks to that, especially as we're in an area with a lot of agriculture, a lot of industry that impacts our groundwater in terms of nitrates. So today I'm bringing one to share a new project that we're rolling out here at the Health District. We got some new funds after submitting a project proposal. And also I want to share a little bit about some of the other community work that's going on around nitrates so you can understand some of the work that's being asked of us right now in the near future and where our land use programs need to go with nitrates. So next slide. So a little bit about the project that we're rolling out now. In summer of 2023, so just this last summer, the Department of Health announced after the ESSB 5187 that there was a new fund they were establishing called the Alternative Water Fund. So this fund established a fund to provide safe access to drinking water for homes, businesses, and individuals with wells or small water systems. Really significant in that historically, through Department of Health, funds that have been opened up like this for drinking water work are usually focused at large water systems, cities, what we would call Group A water systems. It's very unusual for them just to provide money for private individuals with wells and small water systems, or what we would call our Group B water system. So we jumped on it naturally. Our group put together and submitted a project proposal in October, and we were selected as one of the counties to have our project funded. And because our project, by the time we got it into the consolidated contract, was a 6-month timeframe, they awarded us $30,000 until the end of June. But I did just get notification that we'll be getting extended for the next year. We'll likely be getting more in the 50, 60,000 range to cover a full year of the project. Next slide. So a little bit about the project. We're calling it our alternative water project because the end goal is to provide alternative water or water treatment for people who have high nitrates. Now we do still have limited funds in terms of providing water is very expensive. In order to roll a project like this out to the entire bi-county area, it would be extremely expensive. So 30,000, 50,000 a year may go for about 50 to 60 households in reality. So with that, knowing that we had limited funds and statewide, the entire fund is only about $800,000. So it's not huge. Knowing that we had limited funds, really important to us that we carefully examine who is at high risk for nitrates. So we could be very purposeful with the use of this money and make sure that we're really effective with the services that we offer. So who is at high risk, persons at high risk and risk of health effects from nitrates. First, what do nitrates do? High level of nitrates in your water can affect how blood carries oxygen, and it can cause what most people call or have heard of as blue baby syndrome. So bottle-fed babies under 6 months of age are at highest risk. Then we have our pregnant individuals. They're at increased risk because pregnancy raises your body's oxygen demand. Persons with other health conditions like anemia, cardiovascular disease, and lung disease are also at higher risk. And then there have been some studies that have suggested an increase of risk of miscarriage or birth defects from drinking water with high nitrate levels. There have also been some evidence, not thoroughly studied, but there's also some evidence for nitrate-induced effects on thyroid function in adults, metabolic effects like diabetes, possible associations with diabetes, cardiovascular effects, GI effects, and even some increased cancer risk. Those are loose associations, I would say. So our highest risk population, though, we know are those really, really young babies, pregnant people, and breastfeeding, those that are breastfeeding. So with that, what we decided to do with our limited money is to roll it out internally here through our BFHD program. So we decided our environmental health programs, we're going to partner with our WIC, so Women, Infant, and Children, and our NFP, Nurse Family Partnership programs who directly serve clients who are either pregnant, breastfeeding, or have small infants in the home. So with this project, what we'll do is you can see kind of really tiny a picture of what the flyer looks like. Our WIC staff or our NFP staff on their regular visits with their clients will take that flyer. They'll go over some information on nitrates in the homes, really critical information like what to do in preparing a bottle-fed baby if you have high nitrates or if you're on a well. So providing a little bit of education to those clients to make sure that they can keep their babies safe. Then we will also take out a sample bottle or give them a sample bottle, as we are one of the fortunate health districts here because we do still operate our own water laboratory. We're giving them, you can see the voucher at the bottom of the flyer is for a free drinking water sample. So then that client can bring that voucher back and they can get a free nitrate sample for their well. Then further from there, if our laboratory identifies that that client's water is elevated or high in nitrates, then we are providing them with a free countertop reverse osmosis unit for their home so they can have treated clean water for their family. So it is an expensive program to roll out. Again, that's why we reached out and got money out of house for it. We're still seeking, and I'll tell you a little bit more about what's going on in the community, but we're seeking still other options because it's very, you'll hear a little bit more too in the future, probably in the summer when I come back with some presentations around the on-site rule change. Is it's very expensive to treat nitrates downstream, so to speak, no pun intended. But once it's in the water, it's really difficult to remove. So that's not a cost-effective way for us to go about it. We are going to be focusing a little bit more in the future on mitigation upstream. So things like making sure septic systems are operating properly. There's some things that we're gonna bring back to you probably in the summer around that. Next slide. Okay, so I want to shift gears a little bit because this is where it shifts into talking about the work that is being asked of us. So you understand what's upcoming and some of the risk that may be upcoming, with some pressures coming in around expanding nitrate work. So to do that, though, I think it's important to understand a little bit about the history of nitrates in the Columbia Basin. This is an incredibly summarized sentence right here. There's a lot behind it, but I will just say why BFHD, why are we at risk here for nitrates? Frankly, Benton and Franklin counties are at high priority risk for nitrates due to the prevalence of irrigated farming, a lot of irrigated farming on excessively draining soils. Again, that's very summarized. There's a lot behind that. But basically our geology, our industry types, a lot about our area puts us at a little bit higher risk for nitrates in our groundwater. And then where we play a part, this is important because we're not the only ones in the community doing nitrate work. We may not even be the primary agency in the community doing nitrate work. The Conservation District is doing a lot. There's ecology. There's a lot of other entities there. So where do we as the health district fit in? Our role, and if you go back to the 10 essentials of public health, they just pulled out some of those roles in those 10 essentials. In assessment, we assist community partners like the Conservation District in studies and data assessments of nitrate concerns. We offer laboratory support for assessments and monitoring nitrate data. Under investigation, we as the local health jurisdiction do have authority over approving, inspecting, and investigating concerns with small water systems. So systems that have fewer than 15 connections, and over on-site sewage systems. So again, this is where you'll hear more from me in the future about what we can do with on-site sewage to prevent nitrates from getting into the groundwater in the first place, or at least not adding to the issue. Policy development, BFHD drafts local policies for Group B and on-site sewage. So we do have a local Group B ordinance that has been signed at some point in time by the Board of Health. So we have our own ordinance there, and that gives us a little bit of flexibility in setting regulations that help to prevent adding to nitrate concerns. And then, of course, informing and educating community members on topics like testing for nitrates, proper well maintenance, and proper maintenance of their septic systems. Equity is always at the heart of everything we do, and so we are also proud that this program is a program that directly speaks to clients who may already be facing financial concerns or have limited access to health information. So it helps bring that directly to the clients who need it most and are at most risk. Next slide. Okay, so some work, and this is where it shifts in a little bit to the work that's really coming up for us soon. I mentioned earlier that we're not the only ones doing work in the area around nitrates. We don't, that's not just our realm. We just play a part. And I think it's important to understand where we do fit in so we can make sure that both this money and any money that might come in the future, that we're using it very effectively, that we're not duplicating other people's work, and that we're enhancing other work that's going on in the community. So historically, going back to the 1980s, USGS has done quite a few surveys and studies in the Franklin, Grant, and Adams County area around nitrate issues. Sometime about 1998, the Columbia Basin Groundwater Management Area was established. So the groundwater management area is a state designation that's overseen by Department of Ecology. And around the state, they're intended to address various groundwater issues regionally. Our issues here, again, being nitrates, high nitrates in the water. So that, we call them GWAMAs. That GWAMA was formed in 1998 with the goal of reducing the concentrations of nitrates in groundwater of the area by implementing things like agricultural best management practices. In 2005, USGS came into our area again, did another study around that Columbia Basin GWAMA. And then in 2015, Benton County Conservation did a groundwater nitrate monitoring study to characterize the magnitude and extent of nitrate contamination in Benton County through sampling of approximately 200 groundwater wells. Those are projects that BFHD historically has supported by offering lab services and a little bit of follow-up and education with clients. Most of you probably, if you're in Benton County, know about the Plymouth Well project. So back in 2017, they had to start talking about drilling a new community well due to rising nitrate levels each spring. So big, huge project that, again, look at the amount of money it costs to mitigate nitrates once they're in the water, because they're really difficult to get out of the water. Benton County Conservation more recently has done the Benton County Groundwater Nitrate Community Action Plan to address the lower Yakima Valley groundwater management area. So this one becomes really important. That lower Yakima Valley groundwater management area was something that was established in, do you know, 2017, no, 2011? I don't know. If in the near recent
It was
past.
before the 2015 work.
Yeah. That area, yeah, somewhere in that time frame, but that area actually includes a slice of Benton County. So this is important. There is a slice of Benton County that is in that lower Yakima Valley groundwater management area. Benton County, BFHD, Benton Conservation District, all have specific roles and authorities for protection of groundwater. And as such, we were all entities, we were members in that lower Yakima Valley WAMA. After participating for approximately 2 years, the county, so Benton County, for those of you who might, and I'm coming late into this history too, formally requested withdrawal from the lower Yakima Valley WAMA because of some issues happening, saying that they prefer to work on those issues, groundwater nitrate, the primary issues locally with partners. So we all collectively have agreed, hey, let us out of this WAMA, but we will work on nitrates. We promise we'll come up with this plan. We're going to collectively work on the nitrate issue in the county. That's where we are starting to hear the WAMA is something that is sort of predicated by EPA coming into that area. And in Yakima, the Yakima Alley area, the EPA has come in and issued administrative orders on consent on some of the farmers in the area. It's a tense issue, and we don't necessarily want that extending down to our area. Let me change that. We don't want that extending down to our area at all. So we're starting to hear at the health district through DOH that EPA at their quarterly meetings is starting to ask questions about what are they doing in Benton County? What's being done in Benton County? We want more updates. We want to know more. So this nitrate project, very, very small piece of it, but we're starting to roll things out to try to show there's action happening. However, can you go to the next slide? I promise this is my last one. DOH approached us in the fall, and they brought us what they called the Benton County Nitrate Hazard Mitigation Plan. They spun up a plan and said, hey, what do you think about this? Could you do this? It is a plan that Yakima County has tried to roll out, and it has taken them about 10 staff to roll it out, and it has been difficult for them even to roll it out with that many staff. And they were offering us 0 staff. So the work that's already being done is being done spread across many staff that are already quite overtapped. So I did manage to work with DOH to get a funding ask incorporated into the governor's budget. It was put forth during the 2024 ledge session. They did fund approximately $1 million. We got word a couple of weeks ago that almost all of that $1 million will be going to Department of Health and Yakima County to finish their work. We are going to ask for, they're going to go back and ask, I don't know what the answer will be yet, but they will go back and ask for money to fund a GIS specialist so that we can at least start some mapping of wells in our area so that next year we can potentially roll out this work. And then they've promised in the fall that we'll go back, we'll do another ask in the governor's budget as they're going into a capital session in 2025 and hopefully get more money to fund more staff. But until then, we'll kind of have a little bit of a gap there. So a lot of work being asked, not a lot of staff, but we do have some stuff rolling out that we're at least using at this point to show them that something is happening. And aside from that, it's not just we're doing this to show EPA what we're doing. We're also doing this because it's part of our commitment in the Conservation District, Health District, Benton County plan that will play a part in that nitrate work in the community. So we want to make sure to continue that commitment to that plan.
I would shoot us an email too, if you want to remind us on that. So we start talking to our state reps, our state senators, so we can go ahead and push that agenda too.
Yeah, that would be good. I know Yakima, talking about Yakima County rolling out this work, when they rolled out their project, they were funded about $800,000. And then later Ultimately, they got about $1.4 million to do their work, but it was because their county specifically pushed forward and asked through the legislator, and it was funded in that way. So that would be excellent. We had that support. Yeah.
But they were trying to push regulations and other things in our county that didn't make sense for our area.
Yeah.
Which is why we, a lot of the money and work they were doing did not benefit us directly. And it was not worthwhile to us and our residents.
And that sounds like the temperature, everything that's coming in through the consent orders it's complicated, when EPA comes in. They're not bringing any money to the table. There's a lot of them asking work to be done, wishing work to be done, but not a lot of money coming to the table from them. So it's definitely in our best interest to continue to kind of lean into the nitrate work. Both for our community, it's an important resource, it's an important topic to us as public health. But we also want to make sure that we're kind of staving off some of these outside entities to come in and tell us how to do it.
Yeah, sorry, I was gonna say, it's also complicated because they keep targeting some of our farmers and producers who really are good at their nutrient management because they have to be to make the crops work for them. And we have a lot of other places that nutrients are coming from. That, I think some of our ag gets unfairly targeted on some of this work. And so it's very important that, these projects have that clear transparency, doing due diligence. You can stop there on my soapbox.
Yes.
Yeah, so are all private wells permitted so that we can locate all of the private wells in Benton County?
No, yeah, there's no sort of permit that you're issued. There is a well log there's a well log report that happens when you first drill the well. But the records for that are not necessarily updated in an accurate way over time. So if you're you've lived in your same house for 40 plus years, that might not necessarily be accurate, or if you've moved around and they haven't updated the records. That's part of the challenge. And one of the things that Yakima County, I did have a direct meeting with them, and they said the first thing they did before they did their project, because what EPA wanted them to do is essentially knock on every single door, provide water samples, provide education, provide home test strips. And we don't even know where those doors are, because we don't know where all the wells are. We don't know, and so their first step was months of having a GIS specialist just map so they could actually be efficient with outreach. And even then they said it was a nightmare, because you have renters, you have PO boxes, you have all kinds of complications that come in. And so there's no feasible way we could do this with our current staff. But we've committed to at least trying to set up the project, so we want to do some mapping. And then what I likely will do is I'll probably pitch a different project. Yakima was coming to me saying, don't do our project. It didn't work. Try a different model. So we'll use that time to kind of come back to the table to think of something that might work a little bit better, work with other partners like Conservation District to come up with something that collectively will benefit us and, keep other people out of our hair.
We do have our GIS layers of all the maps that we've tested.
Oh, good.
And
Yeah.
so we have all those layers that we cross-reference. So there's a starting point as a partner that we can share all that
Okay.
work that's been done. So
Be
it's
great. Okay, reach out if you have other questions. It's been an important one lately. It's been rolling at us like a freight train. So yeah,
Where can people go get their water tested?
right there.
They don't charge you, just bring in a.
No, we do charge. It's a fee for service, but you can bring it right up to our EH desk. And they do a variety of water chemistry, things like nitrates. They can also do like bacteria, coliform. Yeah, like I said, limited water chemistry, but
How much of a sample do they need to bring?
it depends on the type of sample. It's probably best they just call and get instructions. Some of them, there's special bottles that have inhibitors in them, but some of them you can just bring in a water bottle. So I would just advise call to the desk ahead of time or the lab, and they can give you really good instruction on what type of bottle and how much to bring in. It's on our website too, yeah.
Thank you.
And then the pilot project is at no cost to those who fit that specific criteria.
Yes, sorry, I forgot to discuss that.
I know there's a lot of people that don't even know how much nitrates are in their water. I just heard a couple weeks ago that there was an elderly couple, they were selling their house. They did a water test, it was dangerous levels of nitrates. Buyers decided not to purchase a home, and it was advised to let the the owners know that I'm an elderly couple, that they were way, way high on their nitrates. So, yeah, it's important that we.
Yeah, and it's expensive. You do that water filtration to maintain it. It's a complicated issue for sure.
All right.
Mr. Chairman?
Yes, go ahead.
Yeah, Commissioner Didier here. Hey, got to talking to my mother, who is 93, very sharp though, very, very sharp lady, very coherent. Back in 54, when they drilled their well out here in the Columbia Basin Irrigation Project, we're just about 15 miles north of Pasco. The well that they drilled, the nitrates, there was no farming going on at that time. And the nitrate levels were so high that infants couldn't drink the water. So to blame this on farming is an injustice, as I heard earlier. And I don't think that we want to lay any more attacks on the farmers who are being attacked enough now in all directions, because we all do need and like eating.
Thank you. Mr. Kyle. Request for approval.
Request for approval of an environmental health specialist to stave off the EPA. So this will be a drinking water oversight specialist for the nitrate project. We'll have it supported through the consolidated contract and some of our general fund. And Aaron said that we'll have an extra funding source coming in for this project. So should be budget neutral, so.
Magic words.
Absolutely.
So I'll move for approval of the one FTE environmental health specialist. Would you approve it?
We have a motion second. Any discussion?
Full job.
Think that until you have to go knock on doors.
Dangerous job.
All right, we have
I
a
didn't do that for a little bit.
We have a motion and a second. All in favor, say aye. Aye. Any opposed? All right, thank you.
Thank you.
Thank you all.
All right, food safety, temporary hand washing stations.
I'm doing too much talking here.
Do you wanna come up? William? Or Aaron, whoever, we can. Yeah, it's on. You have a-
I got the old one.
Yes. It was on and off and on and off.
The one without the staple is
But we're back
current
on.
agenda.
That one's off. We didn't have the updates, but it gave us time for this topic too.
So I'm Aaliyah Jensen, I'm a food safety supervisor. Temporary hand wash stations is the topic. So in the code, we follow what the code says. Insulated container with warm water, free flowing spigot, and a catch bucket, paper towels, and soap. Is there any questions on the setup?
What temperatures the water have to be?
So the code says the water has to be warm. We do have a threshold for 80 for our inspectors on when to write out a violation. As a group, we decided at 80 degrees that it's warm water, and if it's below 80, we'll write out a violation and have a corrective action. At 60 degrees, it would be a closure until they can get warm water.
The code does define in other areas that warm water is 100 degrees. And so, like she said, there has been policy in-house set to be a little bit more flexible with that down to 80, because it really, 95-degree water is comfortable.
I ask this because honestly, this is the only county I've ever experienced that has a temperature set on the hand washing water. I literally have done food in at least half the United States.
Yeah, I mean, that's a statewide requirement. And my understanding was the question that kind of preceded this too was about, an incident that happened over the weekend with a vendor being closed. And I think it's really.
It was, and I'm getting conflicting stories
Yeah.
because he said he was shut down. Said that when they temped his water at 60 degrees, that he actually went and put warm water in it and got it up to temperature. But they shut him down because he has a yearly permit. And in order to use a temporary hand washing station, you have to have a event only permit.
Yeah, I think, so that's where it's really important to clarify the difference is if you're, you've done food in multiple arenas, right? You've got an annual permit at a restaurant, you've done the fair, the above the shoots, things like that. So you could come in if you have a mobile unit, this was categorized as a mobile unit, a hot dog type cart. They can choose to come in and operate on a temporary permit. Anybody can operate an tent and table with a Coleman container kind of set up for a hand wash. But that requires a temporary permit under our Washington State Food Code. Permits are required to be inspected within their permit period. So if we issue a temporary permit for 1 day, we have to inspect you on that 1 day. That is one of the reasons why our food code allows for operating on less than standard facilities at a temporary event. You may see a tent and table because they're inspected every single time. So we can kind of make up for that equilibrium of safety by saying you get oversight, you get review, permit review, you get menu review every single time. On an annual permit, like at your restaurant, you're not inspected every day.
No, about once a
Nobody
year.
would want to, yes. And that's
And I
the
guess that's
case
another
with
point
this.
too, is, I mean, I'm no longer in the food business as far as a restaurant.
Yeah.
or anything Like that. But I mean, I've been up and down California, multiple locations. The hand washing station, I guess, in this particular situation where the person called me, here you have an annual permit and let's say his hot water heater breaks or he gets a crack in the line, has no access to water. So he is now shut down because he cannot use a temporary hand washing station when he provides all requirements of a hand washing station, which is insulated container with the on-flowing spout, warm water, hand towels and soap. He can not longer continue because his permit situation broke. I mean, there's no scenario in the world where you have something that never breaks.
Yeah, I agree. Yeah, our aim is never to be punitive. And so I will say that our policy has changed on that over the years. And now with Aaliyah as the supervisor, we are writing a new temporary policy on that. So in the past, back when Susan was here as the supervisor, if we in the field found somebody, say, operating without a permit or, they didn't have a temporary permit, then they would be allowed to come in on Monday and pay for that permit. As long as you're set up safely, so your hand washing station set up correctly, your booth set up correctly, we can conduct an inspection, check that you're safe, you can come in on Monday, pay for that.
Plus the late
Now,
fee.
plus a late fee, because it does take us
'Cause
extra
otherwise
time to
you would get a
navigate that
permit
in the field.
everywhere. You just hope that they
Right.
never showed up.
Now, under the last food safety supervisor, it was noticed that that is not necessarily a fiscally responsible policy for us because the amount of time we spend with unpermitted vendors, it takes much longer to set them up in the field. We also don't want our staff handling money in the field, taking applications in the field. And we were having a lot of food vendors who would just skip out on us and never come back and pay. So what that does is that ends up driving up permit costs for everybody else. So he did reset that policy about 2018 to say, nope, if you don't already have a temporary permit, then you're not going to be allowed to continue operation in the field on the weekends. Here, we'll talk to you about it. We'll set you up correctly for next time. Now, this vendor in question is not a temporary vendor. They have an annual permit. So the annual permit means you come in, you get a permit for a whole year. You're only inspected 1 to 2 times a year. You get more freedom of menu, you get more freedom of where you operate, how you operate, what type of events you operate on. But the caveat that comes with that is you have to come to us with more professional facilities. To get that lower inspection, oversight, you come with a food truck that has a tank. The food code, the Washington State Food Code requires that mobile unit operations have water under pressure, warm water, so 100-degree water under pressure from a tank through a faucet, so not a temporary setup. So that's the distinction here, is this person was not a temporary.
So what happens
And
when a permanent, they follow all the rules, they
Yeah.
get there, they crack a hose line.
yeah, so that's
Now
where I
they-
was saying,
now they
right
just have
now,
to-
we don't
they
have a
just have to walk
policy in
away.
place.
Have to be shut down.
Well, one, when they apply and they sign that permit and we give them a letter. In fact, I wrote this person's approval letter in 2018. And I went back and we looked at it and there was a paragraph in there that gave clear direction on, you need this hand sink, it has to have hot water under pressure. If it breaks, you need to close, you need to call the office. Sometimes we can maybe navigate that if willingly self-close and call and say, what do I need to do? How do I navigate this? But if you skirt that and decide to keep going on your own, you know, the message I got back from the field was that they were not set up properly. They didn't have an insulated container. So they didn't even meet the temporary hand wash standards.
Well, that, I guess that's a discrepancy because he
Yeah.
told me he had an insulated beverage dispenser with an on-flow spigot.
And that's not the message we got from the inspector. So if, you know, if he wants to bring that unit
No, I'm
in and
just-
have
I'm
us
just-
look at it, we can
bringing
take
it
a look
forward.
at it.
Yeah, the report did say that it was not insulated. It wasn't an insulated container.
But it does highlight a good, you know, we never intend to be punitive. Our goal in public health and food safety is to protect the health of the public. And you're right, you know, if we go out and you're right in the sense that if we go out and something has happened, but they have set themselves up correctly as a temporary, we do want to be able to let them continue operation. So Aaliyah has more recently, within the last couple of months, assumed that position of the supervisor. And this is one of the policies she's already working on writing, is a temporary food establishment enforcement policy that now has a new section in it, once it's approved, has a new section in it that will say, you know, if in a temporary situation, if you're caught operating without a permit, which in this case, this person was, because they were not operating to their annual permit standards. They were trying to operate as a temporary, understandable, you know, they're gonna do what they gotta do in the moment. But you're set up correctly, then as long as you're willing to give us some information that will allow us to collect the fee later in case you skip out on us, which most people don't, but some people do. You're set up properly, you'll give us some information, we'll let you keep operating, and then you can come in on Monday and pay for the permit. So we're gonna try to get that pushed through and in place as quickly as possible, because I think it's a friendlier policy both on the inspector and the vendor. We don't want tension, but we also want to highlight that we don't want to set up situations in the field where our inspectors this weekend, that weekend in particular, we had 12 different locations to get to and 23 permits to inspect. So if somebody is not set up without, you know, what we got back was without an insulated container, we cannot wait until that person goes to the store and comes back an hour later. That's driving permit costs up for everybody. If every one of our, what should be a 10-minute inspection turns into a 2-hour, because this person has been told multiple times that they can't do that. So it's not a new thing. You know, we've got stuff in writing we've given to them saying they can't do it, so.
Well, obviously, there's some discrepancy because
Yeah.
what he told me he was using as a water source was basically those insulated dispensers that caterers use.
It's like a Cambro.
It was a Cambro is what he told me it was.
Yeah, I wasn't there either.
And I wasn't there either, and I'm just taking him at his
I
word.
get it, I get it.
But
If he wants to
it
bring
is
it
kind
up,
of,
we can take
it's
it.
kind of disheartening to hear that somebody who has a permanent card and for some reason his hand washing station isn't working, that he now has to go buy another permit because he has put up a temporary hand washing station that, according to him, what he told me, meets all the requirements for a hand washing station.
For a temporary,
For
for
a
a temporary
temporary.
permit, right? Yep.
But
Yeah, I know, I get it, but again, when you come in and you apply for that more flexible permit, you're signaling you're coming in with more
he
professional
applied with
abilities.
a professional
Yeah.
yearly card
Yes.
that I don't know if it broke down or if he could, the operator couldn't figure out how to put the water in.
Yeah, it was not the primary operator working and their employee did not know how to fill the tank. So that's also a big push of ours in food safety, is making sure that the person in charge has training in place to make sure that their employees are aware of how to operate their facility.
I would agree with that.
But I mean, I know you know that.
Can I offer a suggestion here?
Sure.
To get some of us out of the go-between here is, could we sit down with the owner and maybe have them come on site, bring their equipment that they had? Let's work through, I think there's some communication things here. And given that we're in the middle of revising this policy, I think relevant feedback from our community is valuable when we're in the middle of rewriting.
Yeah, if he's willing to bring it forward, I mean, the temporary hand washing station is pretty simple. It's an
Yeah.
insulated container with an
Yeah.
open valves that will run continuously with hands off, soap, paper towels, and a
Yeah.
catch bucket.
Yeah.
It doesn't get much simpler than that, but
Let's get them all together and let's
Yeah,
talk.
sure. If they're willing to come forward. I'm out of it.
Stay on. All right, we're running a little bit over time. Let's move on to approval, or no, overview of National Public Health Week.
I'm gonna be really fast. I'm Sandy Salisbury, Communications Coordinator. I work with Amanda Mason. She's amazing. Woo-hoo. Okay, so I'm gonna go quickly. I have slides. I'm gonna go over public health, National Public Health Week and what we did in-house to promote that, but also just a general overview of how our social media impacts the local community and why I believe it's important. And I'm sorry if you don't need to be convinced, you'll feel convinced at the end. So the next slide, go ahead to that one. In our mission, we have these words: promote, prevent, protect, but in there it says we promote healthy lifestyles, we prevent disease and injury, and protect our environment. So I kind of put a little spin on there to say these are the things we kind of focus on when we're sharing on social media. We promote by increasing community engagement. We prevent through awareness, through health awareness, and then we protect by sharing updates on services and events with the community. So go ahead to the next slide. On here I have, it's kind of small here, so if you don't have any helpers, I'll help you out. But these are demographics from Facebook and Instagram, our two biggest social media platform followings. So here it's breaking it down with age and gender, and you can see we kind of have like a female lead on both of these. I think it's just demographically overall, females tend to follow us at a higher rate. Which helps us to craft content in a way that maybe would appeal to that demographic, but also helps us to see how we can shift our narrative or shift our engagement to actually pull in different demographics into the lead. So we can cater to those in the age demographics that aren't looking at what we're doing by creating content that would draw them in, because there's really cool algorithms built into social media that would do that for us. So it can help us to focus ads on who we aren't already reaching. That was just a fun little look to show you who is there. So it kind of shows you our followers too before we go to the next slide. Facebook right now has 7,592. I just pulled these this week, so it's pretty relevant. And then on Instagram, it's much smaller. I wouldn't say that that's uncommon given the demographic range of who's on those apps. So next slide, please. On this one, this is a social media performance report that I pulled from one of our paid resources and city, and it's pulling from these 4 social media platforms, including LinkedIn. So they're kind of small. It's Facebook, Instagram, LinkedIn, which is social media, even though it's geared towards business or your career type engagement, and then also X, which if you didn't know, that used to be called Twitter. So in the last 6 months, and that's what the date range is at the bottom of the slide, it's from the end of October towards the end of through April, so almost a full 6 months. It shows here, and I'll tell you what these stats are. There's been an increase in engagement across all of the platforms. So combining all of these, the posts have gone up. They've kind of surged by 135%, which is really cool. And that shows that there's a proactive approach that we're sharing valuable content, not just content, because there's engagement there. The impressions. So an impression isn't just what we've posted, but impressions pull data based on who shares it. If someone comments, if they like it, if there's an interaction, then an impression can get to you, even if you haven't done anything to engage or even follow a page. That's gone up by 55%. That helps with our visibility and reach. Then there's interactions, which I mentioned. They play into impressions, but those are likes, comments, shares, clicks, and those have gone up by 69%. And then overall, the engagement rate, which is a much smaller percentage number, that 1.7, and that's that bar graph, which is showing that going up, not the bar graph, but the, what would we call that graph?
Line graph.
A line graph, thank you, with those data points going up and down. And that just varies based on what's happening in our community or times of year, what we're focused on. So 1.7% increase. This matters because social media with effective and important information, our strategies can help us to keep the community informed We've seen throughout many different things where people look to social media first, something like open constantly. And when you maybe haven't heard what's happening in the news or on the news because your television isn't on or the news isn't on or you're not anywhere around other people who have heard, you're on social media and you hear it there first, and then you go to Google and then you do the search or then you text a friend. So it's a really great tool for getting information into the hands of our community first. So the next slide I will show you, this is an interaction breakdown. So this is just showing you a little bit more data on how people are interacting. So it tells you the percentages that go up. So we have an uptick in likes by 62, and I'll just go over them quickly. There's been a decline in comments, which isn't necessarily bad because sometimes comments could be people saying things that aren't necessarily positive. So comments going down in this instance can be positive because the other elements are still going up. So we're still getting interactions and interfacing with our community, but we're not necessarily hearing them say everything they don't love about what they're seeing or hearing. And then shares have gone up by 89%. Videos have been a cool thing to analyze because we haven't typically posted many videos. So in the past 6 months, we have gone up in posting those by 190%. That's that 252 number. And then the views, which the number of total views is over 3,000, which is pretty cool. So that has also gone up. And these things matter because it just demonstrates the effectiveness of content strategy and then also retention in our audience. So the next slide is just highlighting our biggest posts. And this one's kind of cool because you can see where I showed you that our following on Facebook was like 7,500, but the impressions that this one post made was over 31,000. So that comes from, you might wonder, how is that possible? If there's only 7,000 people following us, well, each share gains more traction. And then people who don't follow are seeing that because people that do follow are sharing and they're connected in some way on social media. So I just wanted to share that. This was our warming center flyer that was also a digital version. So it was sent out as a press release to all of the partners that might need that to share the vital information where warming centers would be, but then also put on social media. So that got just shared and shared. Interactions 342, which includes comments and shares, likes. So then the last thing I'll share with you, and I'll try to just go through it really fast on the last side, are the details surrounding National Public Health Week, which this year was April 1st through April 7th. So we focused in on what the listed out for us topics should be. So Monday was civic engagement. We did 2 posts. We did our Community of Hope Coalition. And also we shared about a town hall for septic system repairs that was held with the city of Kennewick and Benton-Franklin at one of the schools. Then on Tuesday, it was healthy neighborhoods. We shared about TCMAG, which works to improve transportation accessibility, which isn't something we house, but it was something that we shared. So then on also Tuesday, second one, we shared about the nitrate water alternative drinking program that Aaron shared about earlier. Wednesday, we did climate change, where we shared about the Kids for Urban Trees program. And Benton-Franklin Health District is partnering with them to help get more trees planted within our community at schools. And this is a group of local children who are part of the Kids for Urban Trees. So that one's really cool. Also shared the second post for Wednesday on climate change was learning about air quality monitoring and sharing. So that was more of a share post, not necessarily a take action post, but giving them information. Thursday, we shared about new tools and innovations. The 2 posts, it was our environmental healthy, I'm probably butchering this, the EHS, help me out. For
EHA?
No, for the schools. The schools program for
the indoor air quality monitoring.
The playground inspection tools. I should have led with that one. And then there's a program in place to help schools get inspection kits so that they can verify the safety of playgrounds. And then also we shared about the enhancements within our lab and the different testing. I'm trying to go quickly and now I'm losing words for different pieces that are being elevated in order to keep our lab doing what they're doing, but at a better rate and testing within greater measures. Then Friday, we did reproductive and sexual health. So we shared about our STI testing specifically for those in prenatal care, and that we offer that testing within BFHD, but of course we encourage those who are pregnant and seeking STI screening to go to their providers before coming here and getting tested within this place here. Also, we shared about the perinatal collaborative and when they meet and why they meet and what that access is for. Saturday, it was emergency preparedness. We shared about how to build your own emergency kit, as well as encouraging families to make a plan for communication for emergency. So we just did one post Saturday, one post Sunday, and Sunday was just kind of like a call to action, advocate for policies, prioritizing why public health matters in our community, and what people can do. And we shared a link to the AA. Let's see what it's called. I'm glad I have notes. We shared a link to the APHA Action Alert website where they can share what they think should be happening in the future of public health. And we put a really cool post up there trying to call people to action to get involved locally because their voice matters. Any questions?
Any questions?
I don't know how fast it was, but I
Good, thank you. All right, we'll move on to approval of vouchers.
I'll make a motion for the Board of Health approves of voucher numbers 24-2024 through 32-2024, then $67,616.84.
Second? Okay, we have a motion and a second. Any discussion? Hearing none, all in favor say aye. Aye. Any opposed? All right. Anything from the board? Any comments?
I'm just deeply hurt that the two people over there, the communications person walked out on me. I'm like, holy cow.
I had to get ready for you guys. I had things to do.
I know I'm a troublemaker. I'm sorry.
No, I just appreciate the presentations and everything and stuff, so thank you for doing what you guys are doing.
Thank you.
Appreciate it. So, all right, anything else? All right, next meeting will be May 15th. Meeting's adjourned.